Introduce our fabulous speaker for today. So this is Liam Stewart, and he's a community engagement officer with the National Ambulance Service. He is a HCPC registered paramedic with 20 years experience in pre-hospital care at various levels and across training, the private sector, and voluntary aid groups. His current role focuses on implementation of the National Out-of-Hospital Cardiac Arrest Strategy for Ireland, including supporting community first responders and public training initiatives. A fellow of both the Royal Society of Public Health and the Royal Society of Medicine, Liam is passionate about community education and lifelong learning. So, Liam, if you're happy enough, I'll hand it over to you.
Absolutely. Thanks for being there. So thank you all for joining this afternoon. We'll have a quick run through on what we'll be doing. So we'll talk a little bit about kind of what is stroke, the instance of it or how common it is, some of the things that can leave you more likely and increase your risk factor of having a stroke. And then mainly we'll focus on recognition and what to do if you think you or somebody belonging to is having a stroke, what to do while the ambulance is underway. And then we'll look briefly at what is happening afterwards. So when the ambulance service gets there, what the treatment options are and what the pathways are at that point. And we'll welcome any questions. If you want to throw them into the chat, feel free, and we'll open the floor for questions at the end. Normally we'll be doing this presentation face to face with a group, so sometimes it can take us a little bit more than an hour, but when there's more interaction, so I'd expect us to take the 50 minutes here today or so. So what is a stroke? Well, that's often people in the countryside, particularly people use the term for very often, even when somebody's just generally unwell, to say, oh, she had a stroke, or she took a turn, or she took unwell. But medically, a stroke is when there's an interruption to blood supply to the brain, and that can be from two things. It can be from a clot, or it can be from a bleed. So an ischemic stroke refers to when it's a blockage, and then the hemorrhagic stroke is caused by the bleeding on the brain. And for most people, and I'm sure some of you are here today have either yourselves or had family members have experienced this, most people who have a stroke in Ireland, it's the ischemic stroke, which is over 80% of the strokes that people experience in Ireland. And then the smaller percentage there is the hemorrhagic stroke caused by the bleed, or hemorrhage, or some people might have even said a brain hemorrhage. So, in terms of its incidence overall or how common it is, second leading cause of death worldwide, 12 million strokes annually, and 1 in 5 people worldwide will have a stroke in their lifetime. So, really quite common. And even until I started getting involved in this in the training side, I wouldn't have realized how common it was across the world. In terms of where the word comes from, it comes originally from the Greek word apoplexia, which is where a sudden strike or a deadly blow, and that was where the word came from originally, and that word was because a stroke hit people suddenly and out of the blue and hit them with huge force and had a major effect on their body. So that's where the word originated, and the first lay use of the word in English was in 1599, and it was referencing there a stroke of God's hand. So it was believed it was just a sudden strike. Now in Ireland, around 7,500 strokes annually, 6,000 people admitted to hospital, slight majority male. Most people are over 65, but a significant minority, so 25% of people who have a stroke are under 65, so it can be young people, and with an average age of 72. And as we said, they're over 80%, so 85% there ischemic, and year on year that figure floats somewhere around there, 84, 85, 86, 87% ischemic. And in Ireland, the third leading cause of death, so quite a significant impact in terms of mortality for people who experience it. And on that, very often it's not the initial day or two that happens. It can be down the line afterwards. And then prompt treatment can greatly improve outcomes. So the treatments for stroke have improved dramatically over the last number of years. And the National Office for Clinical Audit do measure stroke treatment and stroke pathways in Ireland. And there's a huge improvement over the last number of years. We'll talk about that a little bit later on. So the treatments have come forward leaps and bounds. There's some things that can leave people a little bit more likely to have a stroke. And in the past, I would have wondered why we discussed this so much in the likes of first aid training and question perhaps even the benefits, but seeing more and more that it's actually really useful to be aware of these risk factors, because while there's some of them that we can change, There's others that we can't change, but if we know that we're in the category that we have factors that we can change, and that includes things like our gender, and our age, so we can't change as we're getting older. We can't change our family history, but we can change some risk factors, and those are high blood pressure. So people who have unmanaged high blood pressure are much more likely to have a hemorrhagic stroke. So the importance of that is to, if your doctor has prescribed blood pressure medications, to actually take them. If the doctor has advised monitoring blood pressure at home, to actually do that and to report back to her or him if you feel that your blood pressure needs review, your medication needs review. We certainly can change habits around smoking, and there's smoking cessation support available from the HSE in across the country. Diabetes, if we have diabetes, we can try and make sure it's controlled, because uncontrolled diabetes can increase our risk factors. High cholesterol, obesity. So another risk factor that can dramatically increase the chances. Physical inactivity, so regular exercise, even small amounts of movement, can help. Excessive alcohol intake, and then atrial fibrillation, which can be detected from an irregular heartbeat. So sometimes you might have been told by your pharmacist or a family friend that you have an irregular heartbeat. So if that is the case, maybe letting your doctor know, and they can check out to see if you have this atrial fibrillation. Why? Because that can increase your chances of having a stroke. And an awful lot of people, so 28% of people who are discharged from hospital after stroke have a diagnosis of atrial fibrillation. So a lot of those people have atrial fibrillation, and a good chunk of them didn't know about it beforehand. So they only learnt about it after they were admitted to hospital for the stroke. And having been around to quite a few of the stroke support groups in the Northeast, that's a common theme from people who are attending the groups. A lot of them mentioned that they found out about AFib, and that was actually every group, I think, had somebody there who mentioned that that was something they found out, and they're now on treatment for AFib. So that's a pretty relevant thing that we can look after. So if you think that might be applicable to you, or ask your doctor about that if you have that irregular heartbeat. There's lots of tools that can be used to assess the risk of stroke, or to assess some people for a stroke, but the simple ones are the best. And the simple one we use in Ireland is the FAST acronym, and we'll go through that now here step by step. Um, so, face, looking at the person's face, has it fallen to one side, asking them to smile. So that can be something as simple as, okay, Michelle, give me a big smile there, Michelle. Big smile, big smile. And then we'll see how Michelle's smile work. And you might not. So hopefully it's one of your own friends or family. But if it's somebody you don't know, maybe it's somebody you're out and about and you've met them socially, or it's a neighbor, ask their spouse or whoever else is there, if there's other neighbors there, friends or children or nephews or nieces, how does your aunt look? How does your mother look? Does that smile look normal to you? Because they might have had previous strokes in the past, they might have other conditions that maybe their smile isn't always balanced at baseline. So it's good to know from them if that's abnormal. So get them to smile, get them to hold their arms out in front of them. So get them to close their eyes and hold their arms out in front of them for 10 seconds. Um, and see, do they keep both arms up in the air? Does one arm droop down? Does one arm kind of wave? Or maybe they use one arm to hold up the other. So you might see differences there. It might even be that one arm is a little bit weaker than the other. And then speech, is the speech slurred? And the common one that we'd expect or describe is a speech is slurred, but very often it is the person's speech is incomprehensible. They're unable to communicate. They're not able to answer questions appropriately. So how can we assess that? We can say, okay, Laura, I want you to repeat a sentence for me. I want you to say, the sky is blue. And if Laura says the sky is blue and speaks normally, that's great. But if Laura says, yes, it is, or the sky is, or okay, rather than actually repeating the sentence, then we're a little bit concerned. So if she doesn't repeat the full sentence, we can just say, okay, Laura, I know it seems a bit silly, but it's really important. Will you repeat that sentence for me? The sky is blue. And we'll see how she goes then. And if any one of those signs is off, so if the face is drooped, if the arms are weak, or if the speech is slurred or incomprehensible or not normal for that person, one sign is enough. And that's where this when stroke strikes, act fast. So at that point, we need to call 999 or 112 for the ambulance service. One sign is enough. We don't have to wait for all three. And speaking to the nursing leads for this, both regionally and nationally, it's a common theme that people think, oh, sure, yeah, her speech is a little bit slurred, but her face is fine. Or she has a little bit of arm weakness, but her speech is fine. And to think, that because the person hasn't all three signs, they're all right, and they decide to let their family member or their friend go and have a rest. And sure, if they're not better tomorrow, if they're not better later on, we'll go to the doctor. But in terms of treatment for stroke, time is definitely crucial. So waiting those few hours can be the difference between treatment being possible, treatment being effective, or no treatment being possible at all. In terms of the time to ring 999 or 112, there's a few things that to focus on here. So when you ring 999 or 112, both of those are the emergency numbers in use in Ireland. It doesn't matter which one you ring, either one will get you through to the ambulance service. There can be some advantages of 112. If you're in a rural area where there's limited coverage, 112 will pick up the best signal. If you have to borrow somebody else's phone and it's locked, 112 can be used. If you tap on a smartphone, if you tap the emergency call button, you can use 112 there and it'll override the security features to make the emergency call. It'll work if you have no credit in your phone. And if there's any signal available at all, so even if there's a signal from another network, not yours, 112 will work. 999 should in most cases, but 112 will once there's signal available. When you ring 999 or 112, the first person you speak to is an operator, and they'll just say to you, emergency, which service. So if you think somebody's having a stroke, you can just say ambulance. They'll then say what county you require the ambulance in. So if you say County Louth, they'll transfer you. If you're in Dublin, which I imagine a few of you are, they'll ask you a few more questions to find out what part of Dublin you're in, because Dublin Fire Brigade provide emergency ambulance service for most of the city, and the HSE do the outer suburbs. So what can be really helpful is if it's an ambulance you might require, then you can ring 999 and say ambulance Dublin City Centre, ambulance Stillorgan in Dublin, ambulance County Cork, and that preempts the second question and saves you 10 or 15 seconds when you're already in a bit of a panic. So if it's an ambulance you might require, say ambulance in whatever county. If you're not sure whether or not you need an ambulance, so if you're like, I'm not sure if she'll go to hospital, I don't know, it's my mother and she says she wants to stay at home. If it's an ambulance you might require, still ask for ambulance County Cork or County Louth or wherever you are. When you get through to the ambulance service, they'll ask you a series of questions. And I preempt this and I like to talk about this because a lot of people find it really useful for whenever they do ring, so they understand the system and they're not panicking. So the first thing the operator will say to you in the ambulance service is ambulance emergency, caller please confirm your phone number. So give them your phone number. They'll then ask what address do you need the ambulance to. If you have the air code, absolutely give it to them. So you can give them the air code and you can say it's H16A, whatever. And then they'll still get you to verify the address. So they'll say, okay, what address is that? And you might say it's Main Street, Cavan. They will have input that air code onto the system, but they'll just want to make sure the address you give matches it because sometimes people get a digit wrong. So they will verify the address and then they'll move on to further questions. The first question is always going to be tell me exactly what happened. They'll get things like the patient's age, their gender, and they'll ask questions like are they awake and are they breathing. If the person is not awake and not breathing, they'll talk you through CPR. They'll remind you to get a defibrillator if there's one available nearby. If you, however, say when they ask you, tell me exactly what's happened, you say somebody's had a stroke, they will start asking you some more questions and they will ask you to go through these fast questions or this scenario, these tests with the patient. And it's useful to do that because that helps them to categorize the call in terms of stroke symptoms. So they will guide you through this assessment with the patient over the phone. Depending on how the assessment goes, the call may notify a text message may be generated to notify community first responders in your area. And I know there's a few community first responders here online today. So they're volunteers who go to you while the ambulance is on way. And there's about 330 groups like that across the country. So they'll go and provide assistance while the ambulance is on the way. One of the questions I'll also ask you is when the symptoms started, and we'll talk about that a little bit more in a few moments. So facial droop or arm weakness or slurred speech, ring 999 or 112. We should be ringing an ambulance because this, if it is a stroke, is an emergency. If you ring your local GP and it is a stroke, there's nothing your local GP can do other than call an ambulance for you. They're not going to get the ambulance any quicker. They still have to go through the questions the same as you do. Same for out of hours doctor services. So out of hours GP services are fantastic for appropriate calls, but a stroke is not an appropriate call for an out of hours GP service. They will be telling you to call an ambulance and it's just causing you delay. So when you ring them and leave your details and the nurse rings back and you say it's a stroke, the nurse will then be saying to call an ambulance. So it's important to ring an ambulance for those queries. Um, so when you ring, they'll ask you those questions and answer them. Moving on here a little bit. So sometimes people say, well, what if it's just a mini stroke? So a mini stroke or transient ischemic attack occurs when the blood flow to the brain is temporarily blocked. It can cause the same symptoms as a full stroke, but typically resolves within a few hours. It's believed to be a small clot, and the stroke that has the more long-lasting symptoms is a bigger clot. However, these mini strokes are warning signs of a future full stroke and should be treated seriously. And sometimes what happens is people can be a little bit complacent and say, "Oh, she's just having another one of her TIAs. She's had a few of them before. She'll be grand, and sure, if she's not grand in a few hours, we call an ambulance." So, unless a specific care plan has been agreed with a healthcare professional, such as the person's GP, we should always be ringing an ambulance if we suspect it's a TIA or a stroke, because this may be the one that's the full stroke. And if somebody is having these TIAs or mini strokes, they need assessment and medical management to help reduce the chances of a full stroke happening, because many people who have these TIAs or mini strokes will go on to have a full stroke at a later stage. So it's quite important that these are treated at an early stage, and then to prevent the person going on to the full stroke, because there's a massive chance of one within a few years. The treatments that can be given for these people are, it might be the likes of blood thinners or cholesterol lowering drugs, or blood pressure control. It might be lifestyle changes, and sometimes the person may even get surgery. A few things around this, though. Very often these are missed, so it wouldn't be uncommon for an ambulance to be called for a person, particularly an older person, and the ambulance service is called because the person has fallen. But the reason they have fallen is that they had weakness on one side of their body. And the reason that weakness on one side of their body is, so if you have a family member or a friend who is prone to falls, you found them on the ground, it is important that you check if there's anything else going on. So if you notice that their speech is slurred, if they tell you that they took weak on one side of their body, if you notice that their face looks a little bit uneven or unequal, you could do that fast check and ring an ambulance. And if you're ringing the ambulance because they have fallen, let them know if you see the signs of stroke, because they will then prioritize the call appropriately. So that would not be at all rare. And especially even with the falls where the person is on the ground and they're not able to get up because they've taken weak on one side, but they don't really have any injuries. And sometimes family members there might be inclined to just lift the person off the ground and help them back to bed, or to get the GP to come out and check them in a few hours. But if we see signs of stroke, it's important to call for an ambulance and let them come and assess the person. So our general first aid measures are that we should be calling 999 or 112. Answer the questions from the call taker. When they ask you those questions, it's not delaying the help. It's just helping to prioritize the call and make sure that the right help is coming to you. So when they have your address and it's a stroke, it shows up on the dispatcher's screen for the area that you're in. So the dispatcher is looking at that call and trying to see where the nearest available ambulance is, to get them going to you. What else can we do while we're waiting for help? Well, keep the person comfortable and calm. So that's perhaps one of the biggest things you can do to help somebody who's having a stroke. Very often their speech is slurred, they're feeling weak, they're quite anxious, they can't communicate as they'd like to, but most of the time they will understand themselves what you're saying and what people are saying around them, but they're just not able to maybe communicate back directly. So by staying calm, and keeping them comfortable and providing reassurance, that'll really help. It's also useful not to talk about the person, because even though you might not understand them, they very often will understand you. A key piece of information to gather while you're waiting on my operational colleagues to get there. So while you're waiting on the paramedics to get there, is to establish exactly the time of onset. So when did this stroke start? So when was the person last seen normal or last seen well? So if you go to your neighbour at 9 o'clock in the morning and you notice that their speech is slurred, we need to play detective. So ring the ambulance, let the ambulance come towards you, and while you're waiting on the ambulance, try and find out when the person was last seen normal. So that could be asking any other family members, it could be asking carers, it could be maybe looking at their call phone or their caller ID to see did they make any calls that morning with the person's consent, obviously. So trying to figure out when they last were normal. So if you know with slurred speech and maybe they made a phone call an hour ago, you could speak to that person and see was the patient's speech normal at that point. So if so, then we know that they're okay at 8 o'clock. So they were last seen normal at 8 o'clock. And we'll come to why that's so important in a few moments. hospital bag, so helping them to get their hospital bag ready. If it's you yourself at home and maybe you have a history of these TIAs or mini strokes, maybe having a hospital bag ready. So having a lot of us do it anyway. It's something that always would have been in my own house growing up because we had older relations and it was a habit my mother kept on. And then whenever we did a family member was going into hospital, it was great to have that ready to go. But having a bag ready, including things like the phone charger or spare phone charger, maybe the toothbrush and toothpaste. And the relevance of that is that some treatments for stroke are very time critical. So if the paramedics get there and then you're having to ask them to go upstairs and get a bag and get night drowns and get etc., then that can delay transport to hospital. Um, and for a lot of people, they might be happy to just go, but some people just won't go without their necessities or what they view as necessities for them. So it's important that, if at all possible, you have those things ready to go when the paramedics get there, so that if you are showing signs of a stroke, they can as quickly and appropriately as possible get you heading towards the right hospital. Making sure there's good access to your house, so having outside lights on and making sure that there's not a rake of cars blocking the driveway. So it often happens with in rural areas where there's people maybe with a strong family network or strong social supports, that by the time the ambulance gets there, half the nephews and nieces and sons and daughters are there, and there's 4 or 5 cars in the driveway, and the ambulance is having to park 400 meters away from the house to get down because there's a country laneway and you can't get past all the cars and etc. So making sure that the ambulance can actually get to the house. So ideally, whoever's cars are outside, they could move around the back of the house or down the road or into the gate or into the field or whatever suits you, depending on where you are. If you're in an urban area, maybe trying to, if there's resources, if enough people available, maybe trying to clear parking space outside the house so the ambulance can pull in as close as possible. Lights on can really be helpful. Hazard warning lights on a car outside the house is one of the best things you can do day or night, especially in housing estates, because while you might have your house number clearly visible, if nobody else in your housing estate has it up, we can't find you because we're driving around looking for number 57. But if numbers 1 to 55 aren't visible, or 56 aren't visible, then we can't find you. So hazard warning lights on outside the house can really be beneficial. And in the countryside at night, that can be great. And while air codes are fantastic, just having the hazard warning lights on can really show you exactly where you are. So we're not driving along very slowly, trying to figure out which house is which. Pets, your dog might absolutely love visitors on a normal day. It might be perfectly fine and friendly on a good day. But when you're not well and some people come in yellow jackets and green trousers, the dog might not be very happy to see us. So while you might be glad to see my operational colleagues arrive, the dogs often aren't. So if you can get the friendly dog into another room away, that can be really helpful. It helps from when my colleagues are doing assessments, because we might be doing things like ECGs or checking blood pressures and even trying to talk. And then even from an access point of view, they're coming in carrying equipment and bags, and they might be helping the patient out of the house using things like chairs or trolleys or stretchers. And if there's a dog running around, it just makes the whole situation a little bit more difficult. We shouldn't give the person any food, drink, or medication unless the doctor is specifically said to take medication for that particular circumstance. So we don't give the person anything in those situations. So we don't give medications like aspirin for a stroke. We only reassure the person and we collect any medications that they have. So if the person has daily tablets or prescriptions that they normally take, if you could gather all them together to show the paramedics when they get there, that would be fantastic. Keep an eye on the person, so don't leave them alone. And if they go unconscious, ring 999 back and they'll advise you on how to check the person. And if needed, they'll talk you through CPR if the person stops breathing. So if the person you're with deteriorates while you're waiting on the ambulance, absolutely ring back 999 or 112. And by deteriorates here, particularly things like if they go unconscious or if their breathing becomes funny or abnormal, ring back 999 or 112. Um, Some of the stuff we mentioned there might seem simple and obvious, but it can really, really save time from our operational colleagues when they get there. Because if you have all of this done and they go in and they realize the person is having a stroke and it's inside the treatment window, that can be the difference between them spending 15 minutes on scene and 45 minutes on scene. And in terms of the damage caused by a stroke to the brain, if there is every minute of delay in terms of treatment means that the blood supply to part of the brain is blocked for longer, and during that period, there's more and more damage done to brain cells. So the more time we can save by being ready for the ambulance, the better. So we've spoken through those assessment signs again. So to run through them, get the person to smile, Look at the face. Is it even? So is the smile equal and even on both sides? Get them to raise both their arms. Does one arm drift down? Does one arm look weaker? Are they having to use the one arm to hold up the other? And then does the speech sound strange? So when you ask them to repeat a sentence, does it sound strange, or maybe they don't repeat it, or they only repeat it partially? We had a session done by one of the nurse specialists for some of our community first responders in the Northeast a year ago. And the very next day, one of the volunteers went to a man, and every question the man was asked, he just said yes, yes, yes. So it wasn't the speech was slurred, it was just that he had one word answers to everything, which wasn't normal for this relatively speaking young, fit, healthy person. And that was their sign. Their face had no droop, their arms were perfectly fine, but their speech was a little bit distorted. Equally, I mean, somebody I met in one of the stroke support groups a while ago, they only had weakness on one side of their body. They actually initially noticed it in their leg, and I can't remember what they'd done. I think they'd rang the GP because of weakness in the leg, and then they noticed that it seemed to be getting worse, and it was on the entire side of their body. At which point they rang an ambulance. But they initially noticed it earlier on there was the weakness themselves, but they only had the weakness. Their face seemed fine, and their speech was fine. Conversely, I think somebody said in the chat there, I've had people in the groups who have facial droop, arm weakness, and slurred speech, and they themselves, as patients, found it very difficult to communicate to people how they felt. And had a great, in one case, the person had said they actually had great relief when a neighbour said, "Oh, I think she's having a stroke," to the 999 call taker, because then the patient themselves knew that the right help would be coming, and the neighbour knew what was going on. So calling 999 or 112 at any sign of a stroke. Why are we so fussy about doing that quickly? Well, early treatment dramatically improves the person's chances of recovery and reduces the amount of brain damage. The clot busting drugs that can be given are only effective um, and it only can be given for the first 4 hours. So it's important that we get the person help at an early stage so that they can be heading towards the right treatment. There's other options that can be given, and they can be given for up to 24 hours afterwards. But quick response can save lives and prevent long-term disability for that person. So it's really important that we call for help, let the ambulance come to you, and then they can do an assessment and bring you to the right hospital. We've had people in the stroke support groups who've had this thrombolysis who've had some really good outcomes from it. I've also had people who've had the other treatment options we'll talk about in a moment. So this thrombolysis, it's clot busting drugs. So if you call an ambulance for a stroke, and the ambulance service bring you to hospital, or indeed if you self-present to the emergency department, in the hospitals that do this, they will arrange a CT scan for you quite quickly. So a scan of your brain, and if they see on that scan that you are having a stroke that's caused by a clot, they will consider giving you these drugs to help clear that clot. As we see, about 10% of people who presented with a stroke got that in 2020. And can be quite effective. The earlier it's given, the more effective it is. And after the 4 to 4.5 hour window, it's not used because it's not shown to be that effective at that point. A newer treatment is this procedure called thrombectomy, which is where specialist doctors put a wire in and the wire goes up to your brain and removes the clot. 8.6% of people with a stroke in 2020 got that. That's quite a good figure in comparison to international figures. It's actually excellent. So the UK, parts of the UK are down as low as 2% of people getting that treatment. So we're doing really well in terms of thrombectomy for the surgical removal of a clot. It's done 24/7 in Beaumont and it's done during office hours in Cork. It's a quick procedure. I had and I will say it was a pleasure of hearing a patient speak at a conference a few years ago who had this procedure performed, and he spoke about how he had the signs of a stroke. His wife rang his daughter rang the other daughter had been a carer, had worked as a healthcare assistant. She knew that this sounded like a stroke and rang an ambulance. My colleagues in Dublin Fire Brigade responded with an ambulance that took the patient into hospital in Dublin. The Dublin hospital done a CT scan, realised it was a clot, sent the person to Beaumont for a thrombectomy. The patient went over to Beaumont, unable to speak. His speech was very slurred, with an almighty headache and feeling very unwell. He had the procedure done in Beaumont and he was awake during it, and suddenly the headache was gone and he could speak normally. So on the way back to the hospital he came from in Dublin, after the procedure, sitting up talking to the paramedics as though nothing had happened. So a real a success story there, and many people are getting that procedure. One of the reasons it's quite important to ring 999 or 112 is that the ambulance service have certain hospitals that can do this thrombolysis treatment, and there have certain hospitals that have a pit stop type protocol in place where if you come in by ambulance, they're waiting for you, and there'll be a team there waiting to meet you, and they will bring you down for that CT scan quite quickly. And if they realize that you're having a stroke that's caused by a clot, those same paramedics will then bring you on to Beaumont or to the Right Hospital in Cork to have that thrombectomy procedure. So the ambulance service will bring you to the right hospital to make sure that you go to the next best onward destination. So it's quite important that we ring an ambulance if we suspect a stroke. If the person is having the hemorrhagic stroke, unfortunately, blood pressure management and surgery is generally how it's done. So the thrombectomy isn't appropriate there. And rehabilitation starts as soon as possible in order to help the person with the recovery. And over the last number of years, the stroke treatment options in hospital in terms of people staying in specialist stroke units have become much, much, much better. And people are getting the right support in hospital and specialist support from specialist nurses and allied healthcare professionals. So that's become really good in the last number of years. What did, however, go downhill a little bit in the 2020s is the time for people to present to hospital. So people were having strokes, the signs and symptoms, and were delaying going to hospital or delaying getting help. So re-emphasizing again the need to ring 999 or 112 as soon as we see the signs or symptoms. Perhaps in 2020, 2021, 22, particularly older people are maybe afraid to go to hospital, but if we see any sign of a stroke, we should be calling for help. In terms of the outcomes, as we've said, most people now, so 75% of people who have strokes now spend their time in a stroke unit. The median length of time is 7 days, and around 60% are sent home. Um, and just over a 10% mortality rate overall. That pit stop maneuver that I mentioned, where the ambulance service bring you in and you get a scan, one of the first patients who had that performed or had the benefits of that in the Northeast was a middle-aged person who was relatively speaking fit and healthy, planning to go to work that day. Families recognised a stroke, they were taken into the hospital in this region that does that, and then by 25 minutes later, so they got a CT scan. 25 minutes later, the same paramedics took them up to Dublin for that thrombectomy. And again, the person was sitting up in the ambulance on the way back down again and got home from hospital 9 days later, more or less fine. So real benefits for that patient, but the benefits came from the family recognizing this was a stroke and ringing 999 or 112, not ringing GPs or neighbours or whatever else. They rang 999 and got an ambulance coming. So a really good outcome for that person. So the long-term things that can happen for people afterwards in terms of stroke is there can be rehabilitation, things like physiotherapy, speech therapy, and occupational therapy. There can be medication to manage risk factors, support in terms of lifestyle changes like diet, exercise, and smoking cessation. And there is support groups and counselling. And having been round to four now of the Irish Heart Nation stroke support groups and met one of the groups online as well, seems to be great benefit there because there is good signposting both from the facilitators there towards help and support and advice, and then some exercises and activities, but also just from other people who've been in the same boat. Like I found it really interesting to meet people who had strokes at various stages of survival, and they were all helping and supporting each other. So the groups can be really helpful for people to get involved in. So to conclude really, and what we've spoke about, stroke is serious, and we've said about the signs or symptoms there. What I didn't mention yet is that even if it's not a stroke, so if you ring an ambulance for me tomorrow because I've slurred speech and paramedics get here and they bring me to hospital and it wasn't a stroke, if my speech is slurred, if my arms are weak, or if I have facial droop, there is some medical reason for that that could be quite serious. Only one of the last episodes of the British Ambulance Service documentary, BBC Ambulance, the lady where an ambulance was rang for a stroke. And the ambulance service prioritised that call and got there. It turns out she didn't have a stroke, but she had a serious infection that was leading to sepsis. And some of you might have heard of sepsis or blood poisoning. That is often life-threatening or life-changing. So even if it's not a stroke, it very often is something very serious that requires hospital attention and assessment by medical doctors and nurses in a hospital environment. So please do not be afraid to ring 999 or 112 if you suspect a stroke, because early recognition and prompt treatment can dramatically improve outcomes and potentially even save a life. Rehabilitation and lifestyle changes afterwards are quite important. So thank you for your attention.